Things I know about heartbreak. The first treatment for a burn victim is cold water. Snow is better if applicable. The immediate priority is to make sure the area is no longer cooking. Without external cooling, the burn will continue to cause damage, spreading and searing all surrounding tissue even after being removed from the source. The heat will continue to hurt you until you drown it. Sitting in the shower, pelted by chilling droplets, and I recall standing over the boy with the scorched shoulder. The way frays of his blackened skin fluttered in the current of stream water as I poured endless bowlfuls over the burn. Bowl empty, handed to Boyle, who thrusts a full one at me in return. I set to pouring. Boyle refills the empty bowl. One always flowing over the blistered skin, one always plunged in the water. We continued this ritual, fast but not frantic. 15 minutes of prescribed river water. Louis is crying. Louis laying in the mud. The heat that had hurt him, still trying to hurt him. But we were persistent in our ministrations. Eventually, Louis began to shiver. Burns are some of the hardest wounds to treat in the backcountry. The surface area of exposed skin is often so large that infection is nearly impossible to prevent. And they are painful, in a way that nearly defies language. We have a whole alphabet of diagnostic questions. These are vital for the paramedics when we get the patient out of the woods and hand them over to higher care. One of the questions, the Q, stands for quality. What is the quality of your pain? Is it throbbing, shooting, stabbing? Does it radiate? I've never met a burn victim able to answer this question. The pain is blinding. All of these and more. I block the drain with the ball of my foot and let the cold water start to pool around me. It leaches heat but offers no relief. I'm still on fire. Another question. S. This time for severity. What is the most painful thing you've ever experienced? Brace for response. Okay. Thank you for telling me. That is your 10. On a scale of 1 to 10, what would you rate this pain right now? I curl in on myself. There's not much you can do for a burn either. Keep it clean as best you can. Cover with a moist, cool dressing. You can't even wrap it up tightly or else the ooze will adhere the bandage to the damaged skin. Most wounds bleed. Burns ooze. To deal with this, you have to change the dressings often. Keep the patient comfortable. Evacuation should be considered for all but the most minor burns. If you are unsure, use the rule of palm. This rule assumes that the area of an adult palm, excluding the fingers, is roughly 1% of the human body. In this way, use your human hands as a diagnostic. Hover it over the burned area, measuring the damage with intact skin. If the burn exceeds 10% of the total body area, evacuate at once. 10 hands out of 100. 10 palms demanding higher care. I shut off the water and shiver in the tub. Changing state is difficult, but I lift my foot and let the water drain away. I shrug on a t-shirt. It is loose and clean and will not stick to me. How many hands? If evacuation is deemed unnecessary, continue to monitor for infection. Keep the patient hydrated. Treat for shock. Treat for shock. Treat for shock.